Next species of mycobacterium is Mycobacterium lepra. So I think that it is one of the most important bacteria for you because actually India is hyper-endemic by leprosy and a lot of people in your country are infected with that disease. So you should know what to do, how to recognize. It is regular mycobacterium, B gram-positive in gram staining, but actually Zell-Nielsen technique should be used and is preferred for identification of that bacteria. In clinical samples, it appears as clumps or accumulation of multiple bacteria in one side, and sometimes it is described as rounded masses or balls of mycobacterium. So if you will identify a single arrangement, usually bacteria located side by side like a picket fence. So the common properties of mycobacterium are applied for Mycobacterium leprae, only few exceptions, and one of them is Mycobacterium leprae was never cultivated in cell-free culture medium and actually on any culture medium. Few publications, few articles are available, but that those experiments are not reproducible, and the only confirmed and preferred method of cultivation of Mycobacterium leprae is inoculation in susceptible animals, and routinely 9-banded armadillos are used, or if that animal is not available, then food pads of mice can be used in other laboratories. But usually confirmation cultural confirmation of diagnosis is not required, and clinical presentations with staining technique is enough to put the diagnosis. So a few key facts about leprosy. Nowadays, about 95% of all population of our planet is naturally susceptible to, not susceptible to disease. They have immunity, and we cannot be ill. And those people cannot be ill with leprosy by genetic reasons. In common, we have about 2 million people worldwide registered with that disease, and top three countries which share more than 90% of all patients with leprosy is India, Brazil, and Indonesia. So a third country have not stable place. Sometimes it is Malaysia or some other countries of Indonesian region, but in common it is that area. And in general, in a few years ago, more than 200,000 new cases of leprosy were registered. And again, mainly it is the same top three countries. As for example, in Russia, in general, we have little more than 200 ill people and only one new case of leprosy in previous year in 2019. Of course, it is nothing in the contrast with world situation. As you can see on the slide, it is a map of patients with leprosy living in different countries. The most dark gray or almost black region, it is the highest accumulation of people. Again, it is India. Some African countries have less number of people, but again, they accumulate a main number of susceptible population. And in general, Europe, Russia, and some Northern America have very few cases of leprosy registered officially. If we will talk about history of the disease, leprosy is one of the most ancient diseases, and it is described and known for centuries. And common name of the disease in community is Hansen's disease. Disease is described in some ancient civilization, and we have several confirmation of the disease in religions and different objects. So of course, and nowadays it is difficult to be sure that it is leprosy described in some papers, but by all symptoms, by description, it's really looking like. And possibly the earliest account of a disease is described in Egyptian papers, even elder than our current era. We have few artifacts which are looking like description of leprosy as well. And that picture in the center of the slide, it is Nigerian mask, which is looking like an affected person with some unique injuries on the face, dots, which is changing general appearance, and that mask is stored in National Museum of Health and Medicine. So few photos are available online. And of course, disease is known from age when people didn't know anything about microbiology and bacteria, and it was not known why the disease appeared and what to do with it. And of course, people were afraid of ill person because later I will show you a few pictures. It is really changing general appearance. People became ugly, and historically they were called as unclean or living dead people because they're really looking like some corpse or similar to that. Disease mainly affects skin and peripheral nerves, but in most severe cases, it is possible to have involvement of multiple organs, including respiratory tract is the main organ for transmission of the disease, and eyes, which are located in face, and again, skin is mainly involved, and eyes are damaged by anatomical reasons. Uh, Disease is transmitted by air droplets, usually during close and very prolonged contact. So it should be some frequent contact for multiple months, even years, and usually it is one family members or people living in communities who have close contact by natural reasons. And second group of risk is medical staff, medical personnel who is taking care of those people, and they have prolonged contact by professional reasons. Of course, it should be contact with people in active stage who are spreading bacteria in environment, and usually again it is air droplet way through respiratory tract by talking, coughing, sneezing, and other possible contacts. Incubation period usually lasts 3 to 5 years, but actually we have multiple descriptions of, in some cases, where incubation period was as long as 20 years, and there some cases described when people died because of other reasons, but in autopsy, leprosy was diagnosed post-mortem. It means people even didn't know that they were ill, but they already were affected, but they died before any clinical symptom appeared. We have several classifications of leprosy according to clinical presentations. We will give you two borderline forms, bordered forms, most favorable and most severe. It is known as tuberculoid leprosy. It is the most favorable form when only skin and peripheral nerves are affected and internal organs and other tissues are not involved. And that form have the most favorable outcomes because internal organs are not damaged and people have all vital functions not affected. Usually disease manifested, and the very first symptom is appearance of reddish elements on the skin, which will lose sensitivity. It is macula or papilla, which is reddish in color, and when you perform examination or people touching them to check what is it, they feel nothing. And that loss of sensitivity is favorable symptom for further outcome because other forms usually will manifest with intact sensitivity and people will feel everything. Near that area where elements appeared, usually regional nerves are involved, they became painful, enlarged, and you can even palpate them through skin. They are looking like some dense cord in soft tissues. And the only serious complication of that form is spontaneous amputations, or we call it mutilation of different body parts. Usually it is fingers and toes. Because of prolonged compression and lost innervation, tissues will undergo hypoxia. They will lose proper blood oxygenation, proper supplies of multiple elements, nutrients, and other. And because of that insufficiency tissues will die, and usually it is like ischemic gangrene. Some part of extremity or toe will just fell down, and people will lose some part of body part. Few complications of, or even not complication, it is a simple manifestation, clinical manifestation of the disease. When peripheral nerves are affected, it is claw, hand, and foot drop. You can see on those pictures, it is unique clinical presentation. Not affected part looking like normal, but affected one have improper neural functions. Fingers cannot move, there looking like a claw hand, or one foot is dropped out, and you can identify it by even clinical presentation, or people will comply that they have some problems with motility and affected extremity. So it is in the upper picture macular elements which will appear first. They are easy to recognize, can be large, can merge in one element, and again in favorable forms those elements will lose sensitivity, means around people feeling everything fine, but when you will touch that element, they will feel nothing. It is good. So in some cases, those elements can overgrow, and as you see, that tumor-like element, they can have ugly appearance because of overgrowth of the tissue. It is looking like some cancer, but actually it is a manifestation of leprosy. And in lowest two pictures, you have presentation of that leprous mutilations of extremities of fingers, and you can see that partially fingers are absent, and of course it will lead to serious discrepancies. People cannot perform regular daily duties, they cannot have multiple types of jobs. Of course they will attract attention of surrounding people because of that appearance, and usually it is the only serious complication of tuberculosis form of the disease. If you talk about most serious form, the most unfavorable form, it is lepromatous, leprosy, and usually it will manifest in the first steps the same as tuberculosis form. Some spots on skin will appear, their macular in structure can be shiny, but the main difference is sensitivity not affected. And when you will touch those elements, people usually will feel everything. They will feel touching, they will feel pain if you press or perform some prick or other tests. And that form is dangerous because usually skin elements will progress to in underlying tissues, bacteria will spread systemically over the body, and different organs will be affected. With the time, those elements can ulcerate, and they will heal with formation of huge and visible scars. And multiple accumulation of those scars, especially on the face, will change general appearance of those people. And as you can see on the right picture on the slide, those people are looking like some angry devil, or in history it is described as a lion face. Of course, it's obvious that those people are ill, and surrounding people will pay attention for them. With the time, those elements will heal with scars, but bacteria will come deeper into tissues, and different organs can be affected. If it is eyes, and as you can see on the left picture, people can become even blind because sclera will be damaged and scars will obstruct visible area of eye tissues. It can lead to different contractures when joints and skin around the joints is affected. People will not be able to perform full movements in different parts of the extremities. When bones became involved, bone tissue will be replaced with the scar with the fiber tissue, and spontaneous fractures are possible because bones will lose their common properties and cannot perform common functions. With the time, almost the same granulomas as in the TB will be formed in multiple organs, and mainly kidneys and lungs are more susceptible, and replacement of organ tissue with the fiber tissue will lead to different organ failures, and people will die because of such complications as respiratory failure, or kidney failure, or different other. Of course, disease is slowly progressing, and usually people will have chronic loss of different abilities. They will feel more and more worse with the time, and they will live for some years. But actually, the only outcome of the disease without proper management, especially in the case of leprosy, is little outcome, and people will not be viable, or even if they will survive, they will not come back to community because of ugly appearance, and of course, loss of some parts of fingers or toes will make unavailable some professions, and usually those people trying to hide out of community. So we have different, according to different classifications, different kind of age leprosy. Usually they combine symptoms of both lepromatous and tuberculosis, and maximum we have 6 clinical forms with mild to moderate course and different possible outcomes. But for you, 2 forms are enough to know and to tell during exams. So again, a few pictures of lion face and those elements which in lepromatous form can overgrow and with the time form scars on different parts of the body, and actually in severe cases the whole body will be involved. If you talk about treatment, that thing is again described very good in different sources of ancient literature, and actually in multiple European countries and Russia included. Of course, people knew that something wrong with those patients. They saw that some ugly deformations appeared, and it was noticed that actually people with those appearance, they will die with the time. But besides them, they can infect surrounding people, family members, friends, and of course, everyone was afraid of those disease. And when people saw so unique disease, they tried to do something, but no one knew the reason, etiology of the disease. Of course, no one knew what to do with those people, and actually, it's a sad part of our history, but a lot of people were killed by burning because others believed that it is the only way to save surrounding population. And multiple religions believe that actually it is a curse of the devil, and those people have some kind of deal with the devil. They sold their soul to devil or some kind of that thing. And of course, to avoid any contact with those people, they were just burned. And in some countries, even family members and the whole homes, personal stuff, every belonging of those people were just burned to protect other people. It is, of course, not correct. It is the most aggressive kind of treatment, but actually partially due to that practice, nowadays main number of population is naturally resistant to the disease because genes of susceptibility were destroyed, and the whole generation of susceptible people were just killed. It is type of some genetic selection. But actually we have other types of management with those people, and one of the described ritual is, I think, one of the most interesting. When person was identified with those deformations on the skin, it was obligated to put those people in a court, and of course an obligate manner where they were judged as a guilty, and then they were delivered to church, provided with complete funeral service. They were put it in corresponding clothes, put it into the coffin. Specific procedures were performed. They were graved, and all people, surrounding people, they threw the earth in that grave and said some kind of, "You're not alive for us anymore. You died. We're sorry, but we can do nothing. You are dead now." And it was a ceremony the same as the people person who was really dead. But of course, no one graved them alive. they were dug up and dressed in specific manners. Again, we have different descriptions in different types of literature. Some say that they were put it with the black clothes, with the crossbones, with the hood, and as you can see in the right part of the picture, it's kind of regular clothes for those times, but some said that people were provided with the a bell or kind of clacker, and when those people were going by the street, everyone can hear that they are coming close, and those people who didn't want to have any contact could hide closed doors, closed windows, and of course no one wanted to deal with ill person. So those people usually try to find some place of living out of the civilization, or as it's still practiced in your country, those people combined in communities and live together because they were already affected, they had nothing to afraid of, and they perform common way of life, some agriculture and other, but living together in separate communities. And nowadays, actual treatment is kind of similar. Any affected with leprosy person should be isolated in a leper colony. It is separate part of some islands or not very popular places of country out of civilization to prevent possible contact with healthy subjects. And those people affected with leprosy, they're treated here without any visitors with community. They are living here for the whole period of treatment. Usually it is up to 1 year nowadays because of good antimicrobial treatment. But different forms, different types of leprosy can have different required duration of treatment. But again, usually it is not less than half of the year. And of course, they have those people living in leper colonies. They have all required things: water, food, TV, internet. Everything is in regular city, but for the time of treatment, they live in isolated out of some civilization. Treatment is, of course, antimicrobial. We have specific antibiotics for leprosy, and people in obligate manner should be provided with proper food because, similar to TB, it was shown that proper nutrition is very important both in prevention and in therapy of the disease. And vitamins, proteins, and good nutrient condition is one of the factors improving outcomes of the leprosy. Of course, proper sanitation should be performed because mycobacterium is resistant to surrounding factors. It can survive in objects around the people. And several studies show that actually people who were vaccinated with BCG vaccine against TB in a regular manner, they are less susceptible to leprosy than not vaccinated people. Maybe, and it seems like that activity of the vaccine is due to common parts of mycobacterium cell wall, because still it is mycobacterium and some locuses are common with mycobacterium bovis, and immunity against TB have some common ways to interact with bacterium causing leper. And of course, if people diagnosed with leprosy, it means that they were living with relatives for some years, and all close family members, close friends should be checked on the disease as well. In nowadays, it is possible, and we have, of course, multiple cases of leprosy treated completely. And people after convalescence can come back to community if they want, if they have no some ugly general appearance consequences or some problems with those mutilations, they can come back in community. But some types of profession are prohibited for the rest of the days. It is, of course, medical facility activity, any doctor, medical nurse, any medical staff, because in hospitals, people are already with impaired immunity. They're more susceptible to any disease, mycobacterial included. And we had some cases of reactivation of leprosy when people who was treated maybe incompletely or maybe it was not proper diagnosis, but they were identified with the leprosy for the second time after convalescence. And of course, it's not possible to predict. So any person who was diagnosed with leprosy once cannot have any activity with ill people in medical facilities. They can have no job with the children because kids naturally have impaired immunity. And food services is prohibited as well because bacteria can be spread through air droplets, and of course it can contaminate food products, and no one want to eat infected food because mycobacterium is very difficult to destroy. By common methods, it is resistant to heating, drying, and other factors. So people after convalescence should have personal items. Personal, they should not share towels or some toothbrushes and other. It's better to have personal bed, personal dish to avoid infection of close friends and family members. But in general, they can come back to common way of life and continue their common things. For diagnosis, and nowadays, besides microbiological confirmation, we have Leprosy test, which is a type of skin test similar to Mantoux test, but again, few differences are present. In that case, as well, we have to perform intradermal injection, but in Leprosy test, we should take some biopsy containing of skin elements from ill person containing Mycobacterium lepra. It's very difficult to cultivate bacteria, but you always can find enough amount in skin lesions of ill people. After, you need to perform autoclaving of that extraction and inject it into the skin of person who should be tested. The same as in Mycobacterium tuberculosis, you need to evaluate hypersensitivity of delayed type, and first evaluation should be performed in 2 days after injection. And actually, if person have good immunity, they should have appearance of that macular or papular element in the site of injection. It is known as Fernandez reaction. It's looking like simple allergy, redness, enlargement, edema of injected area. And in 2 to 4 weeks, secondary evaluation should be performed, and that element, simple reddish purple, should progress to tubercle or even ulcer. It is known as Mitsuda's reaction. Usually, that test is showing activity of cell-mediated immunity. And if macrophages and other cells are working, they will try to destroy mycobacterium. They will form initially granuloma, and you will have those tubercules, but later they will undergo necrosis to eradicate mycobacterium from the body tissues. And that type of reaction is good. It should be observed in any healthy human, or if you will diagnose affected person, that reaction shows favorable outcome of the leprosy. Means that immunity is safe and disease will have good response, good immune response. If result is negative, no Mitsuda reaction, no Fernandez reaction, it shows the most unfavorable types of the leprosy, mainly lepromatous leprosy. Immunity is impaired, it's not working, and bacteria will easily spread over the body and affect multiple organs. So, as we said, we have only BCG vaccine, which showing some promising preventive results in different studies, but no vaccine against Mycobacterium lepra is available, and non-specific preventive measures are common as in any infectious disease. We showed it in previous slides. It is isolation of ill people, proper sanitation, and proper feeding of medical staff. Of course, people who are working with those people should have common protective measures, wearing gloves during medical examinations, during mask, during contact with those people, and all measures of common measures of infectious prevention should be, of course, followed in the case of leprosy. So that is the last bacterial current lecture. See you in further lectures. Thank you. Bye-bye.